Bienvenue à
Good
cette
afternoon and welcome to this workshop, which is on the strength and fragility of the urban systems throughout the sanitary crisis and towards a better resilience. First of all, I would like to apologize for starting late, but as you know, in this great Mediterranean event, many Mediterraneans get together, and one of their specificities is to be very talkative. So we are lagging slightly behind schedule. Anyway, thank you very much for being with us. I'd like to remind you that this workshop is part of the great conference organized from Marseille. Unfortunately, not in Marseille because of the sanitary crisis, but from Marseille. This is the 4th edition of this forum, Mediterranean for the Future. And of course, this year, the event is dedicated to the sanitary crisis and to pandemics that all Mediterranean people have suffered for centuries up until now. We have organized this workshop in the frame of this big event and with the support of the territorial collaboration units of the regional council, and I thank all those who got involved in the organization of this event. We have chosen to focus in this workshop on the relation between city and health, because since the beginning of the pandemic, we progressively entered into lockdown, and we witnessed and we heard many new questions on cities. At the beginning of the first lockdown, we saw thousands of citizens fleeing to the countryside. So we questioned this phenomenon. We worked on it, and some questions came from this, and this is what we're going to talk about today. We're going to ask about the impact of the city on health. We are going to consider new ideas so as to live better in our cities. And we are going to hear about the experience of one of our southern neighbors. We are also going to explore the new ideas that we have throughout Europe on more sustainable cities, more resilient cities. And we really must have in mind the question of how to live in our territories, their habitability. In order to bring some answers as well, I thank our 4 guests of today. I thank them for being here. So the workshop will be opened in a few moments by Amin Benaissa, who is an architect and urbanist. He's an expert on the project and the strategic planning of urban areas. Throughout his career, he's been in charge of many urban development operations in France as well as in many places in the Mediterranean. From 2006 up until 2014, he's been in charge of the Great Algiers project in Algeria. He also teaches in the Sorbonne University in Paris, and he works closely with us at Avitem. Mr. Benaissa, thank you. You are very welcome. We also welcome, and I thank him very warmly for his presence, Mr. Simon Davis, who is an engineer from Polytechnics, and you are in charge of the AEI agency on the environment, and you have just signed a book called live the city better, bien vivre la ville. And we hope that you will give us some reasons to hope for a better future in this very tense situation. And we thank you in advance for this. As I said, we want to focus on the south, so we will now welcome Mrs. Suad Ben Abderrahim. Mrs. Abderrahim, you've been since July 2018 the mayor of a great city, Tunis, the capital of Tunisia. My country, France, has very tight bonds with your country. We are brother countries, and Tunis is a city with which we have strong cooperation relations. I also recall that you are a doctor in pharmacy, and you've been an activist in your own country for many years. You have taken many risks, and we really thank you for joining us today. You will be able to share with us how life has been throughout the last few months in your city, and maybe you will make your own recommendations. And then just sitting next to me here in Marseille, Mrs. Agnès Rampal, as the mayor of Tunis. Well, she's a pharmacist, but you are a doctor. You're a doctor in medicine. You are deputy mayor of Nice. You are a regional councillor in the Nice Côte d'Azur metropole. You work for the Région Sud. You are president of the Commission for the Mediterranean of this Sud region. You are a member of the Commission for Decentralized Action, and you are a member of the Harlem. And I must also confess, we have a very special relation, Mrs. Rampal, because you are the president of the agency of the cities, the Mediterranean cities and territories. Without further ado, I will give the floor first to Amin Benaissa. We are all ears, Amin. Thank you very much, Mr. Ambassador, Mr. Bernard, Mrs. the Mayor of Tunis, Mrs. Suad Abderrahim, Mrs. Agnès Rampal, dear Simon Davids, ladies and gentlemen. When COVID hit us, I asked myself if I had, throughout my career, ever focused on epidemics. Well, yes, 25 years ago, when I created the strategic plan for the region Alsace, a technician had questioned part of my approach, saying that I had to integrate in my thinking the risk of a new epidemic of Oxylofera. At the time, given what I thought of science, it seemed very strange to me, and he was very insistent, which seemed very suspicious to me. A year ago in Tunis, with the mayor of Tunis, we took part to a municipal council, and many people raised a number of issues, but at no point the issue of a potential pandemic was on the table. It reveals the complexity of the relations between health and our cities. Now, we must see beyond all this, and I will now focus on three subjects: the epidemic, the cities, and ideas. First of all, epidemics. We've always had epidemics, cholera, plague, and we conceived our cities so as to allow the air to go through. In the Middle Ages, it was considered that dirty air, vicious air, was the primary cause of illness. In 1718, the plague killed half of the Marseillais, And again, in 1830, we had the yellow fever and cholera. Then urbanism made a turn, and we had Cerdas in Barcelona, Haussmann in Paris. Urban planning became different. And still, with many others, we've been taken by surprise by COVID. Given all what I just mentioned, and given the presence of epidemic throughout human history, and given our total unpreparedness, we have less certitudes now. Our industrial society was urban, and it is even more so in our post-industrial society. Our economic model has meant a polarization of economic activities. This process has has modified the balance between urban areas and rural areas. There are many dimensions, political, social, cultural, but one dimension is always neglected, and we must recall it now. The territorial thought is carried by people who live in cities. They know very little of rural areas. When you reflect upon territories now, you must change this, and you must turn towards cities. You must overcome disparities, inequalities, environmental damages, economies which generally don't generate enough employment, and the destruction of our environment. We live in a world which has changed from a mobilizing utopia. We dreamt of a better world, and from that we entered into a world where there is despair, fear. Some philosophers said that we must face new challenges, the rise of individualism. For instance, the ecology was based on a background of confidence, but now we are in a context of fear of the future. The feeling of freedom and lightness that characterized us as individuals has been changed, and we now feel homeless and boundless. And this goes as far as some people turning back inwards in their own communities. We have a sanitary crisis, a territorial crisis, and we need new values and a stable identity. There are many questions, and we have a few ideas in terms of answer. First of all, we must reinvent the way we operate. We must listen more carefully. We must be closer, and we must act locally. Local communities throughout this crisis have contributed tremendously to fighting against the pandemic. They've been there hand in hand with people, supplying hospitals, supporting the more vulnerable. So we must really reflect on the importance of that scale, that proximity. We must also come to terms with that utopia that we can master territorial development. Values have been replaced by procedures. Now, we must have a new mind, more open, so as to be better suited for any unexpected event. We must integrate new dimensions, technology, digital health, and we must train new professionals who think more globally and integrate the dimensions dimensions of the digital health, and so on. Third, we must re-enchant our thoughts, our approach. Jacques Seguela, a well-known French communicator, says that some people conceive or design planes, some designs parachutes. Of course, both are necessary, but let's stop thinking in terms of parachutes only. Let's open up the debate. Let's have less certitudes. Let's be more open-minded. And let's dream again. Dream of a better world with a better balance between cities and rural areas. Let's have a more open approach locally. Let's have territorial transition thinkings, approaches. Let's take into account the environmental and technological transition. This must be the basis of our project. We talked about that 2 years ago, dear Ms. Rampal. We must extend this approach to the entire territory. As a conclusion, no, the city is not just an addition, and no, COVID is not just another filter or another prescription. The time has come to put forward territorial projects with a global vision, and I insist on that word, a global vision. That must be the vision of the urbanist who questions political, social, cultural, and economic frameworks on which our tourism have been based so far. Thank you for your attention.
Thank you, Amin. Thank you very much, Amin. Thank you. You just reminded us or underlined an observation we've all made. That is, we all agree, and we were saying it in our windows and balconies during the lockdown by uploading the healthcare professionals. They were on the front line. But you also reminded us that local authorities, the proximity level, were clearly the locations where everything was actually the problem and the solution. So you've all you said that we have to re-enchant the imagination. Well, this expression is beautiful, and it makes it possible to open numerous doors, that of re-enchantment and of the imaginary. And you said that the city, and you're right, the city is not an addition, but should comes from a process and a global vision. So thank you very much for this opening of workshop. Now I'd like to, and thanking him again, give the floor to Simon Davis. Simon Davis. So let me remind you, Mr. Davis, you've just written a book. Let me remind, I'll give the title, I remember the title. Well, to live well in town for urban planning, friendly to health. So since bookstores are just open in France now, we'll offer it to France, so this year. Now, thank you for your presence, and we're listening to you. And we will follow you on positive pathways, because those we had last month were rather dark. Yes, indeed. Good afternoon, all of you. Thank you for your kind invitation to bear with, to have a testimony. So we wrote the book, we wrote the book well before the health crisis. It's work that defines the close link between urban planning and healthcare, health that was mentioned. So now when we read this book again, to have a good life in a city, well, it could be like a bad joke, but still, well, what we see through the link between urban planning and health, well, the links exist ever since the first city, basically. And the city often was a reaction to a pathology, and not as a prevention for or for forecasting a better future. In the strange period we're going through, this is probably what is at stake. That is to reconcile the short time of urgency with the necessary long time of urban development. What is difficult is to have distance and cross-cutting vision when we deal with this epidemic. Yet, I'd have to say that we should not miss the target. It could be misleading about the health crisis factor. Actually, the dense city, as we thought it, is not the cause of all our problems. It is actually quite the catalyst. The container or the embodiment crisis means that we have to reconsider this balance or equilibrium to master the constitution of individuals at the urban level. But of course, we have to, it could lead to increased artificialization of grounds. And the very question of remote work is quite unequal in different jobs and different classes. So the question we can ask ourselves today is that can health be a lasting entry point of the urban project to be not to contribute not to the lack of this, but to have a contribution to the well-being of population? Well, we know more now about the links between urban planning and healthcare more than a century ago. Now, can scientific progress enlighten us? Well, possibly. Well, recently we did this work with the IA Foundation to do a survey with the scientific foundation to look at the physical health, but of course the question of mental health and social health on a more global scope. Well, from this study, what comes out is that when you look at the health globally, not just disease, unfortunately, we need to live with. But it comes from that study, what comes out of that study is that almost 70% of healthcare determinants can be influenced by the urban framework, 20% by the environment, that is the air we breathe, the water we drink, and roughly 50% about the way of life and the socioeconomic factors. 50% is huge. So it's wrong to say that urban planning can be fully therapeutical and cure from ills, but it does an influence by making life more easy and more in line with nature. So, urban planners have a great responsibility to define urbanism that is health friendly. But so this is difficult for us, all the players. We don't think ourselves as being as doctors, but by thinking about the life and living environment. Well, concerning the current situation and the health crisis, I would identify two risks. First risk would be that the epidemic in itself should become kind of an obsession in urban development projects. We don't want to turn the city into a medical center. There is no recipe or miracle drug to turn a sort of a health-friendly city. And let's not make a mistake. There is the notion of physical distance, but not what you call the resident city as we wish so. And in fact, it is an urban oxymoron, the city we go through, it's not the city, because the city, the first vocation of a city is to dialogue, to trade, and to converge. The third risk we could identify is quite the opposite, and I might surprise you, astonish you, but there is a risk that we would forget the epidemic and the lessons to be learned. This, of course, will, even if the consequences have been of urban planning have shown through ages, the history shows that inhabitants, especially urban inhabitants, are very resilient to these major health crises. And 2 to 3 years after the crisis, major indicators of, for example, site occupations, come back to normal. So one question we could ask ourselves is how to keep the memory of the crisis and capitalize on it, and learn from it. Of course, right now, we are obsessed with the COVID, but we should not ignore the other waves.
La vague de précarisation qui accompagne.
It's not necessarily the epidemic, but for example, the poverty, 25 to 30% demand in food banks. 1 million more poor people in France, for example, now. Also, increased vulnerability to pathologies with, lesser management of normal patients and warning indicators on mental health. So, and finally, the climate, the climate disturbances. We have one of the hottest summer ever, or possibly one of the coolest of the next 20 years. And in Belgium, you can see that the heat wave of August should have caused more premature deaths than COVID. So, well, all this is very dark, but now, if we have to open our eyes to all those vulnerabilities, well, we should not abandon anywhere. So we don't want to go from ignoring the situation to to falling to it. So let's go to the challenge, the collective challenge, and therefore, how can we keep hope for the future? Well, maybe we should change our vision about vulnerability, turn it into a great opportunity to rethink the condition of our collective health, and a powerful lever to think differently. Concrete examples of leverage exist in development, and they didn't wait for the sanitary crisis to be triggered. Let me give you a couple of examples. So we will boost our morale. So public policies and urban plan development. Well, through the urban life, we could deal with some situations like lack of physical activities, which is the fourth cause of mortality at the world level. Well, the City Hall of New York has guides, or what they call the active design, that would call for physical activity, and which gave great result, very good result in terms of limitation of obesity and extension of lifespan for the population in good health. But I mean, again, this has to be done smartly. Don't turn it into a kind of a panacea. And in fact, it is the presence of benches for the pedestrians, that's the best way, because this allows for the population which need physical activities to get a rest at regular interval, and this has beneficial effect on their mental spirits. Another key aspect beyond resilience or climatic disturbance, which could be, there is one which could be the object of conference, which is it's to work on the biophilic and multisensorial design, not just with the view, but also the other senses. And this would make it possible through the project, and including in major metropoles and dense cities, to have a reconnection to the circadian rhythm of life, back to seasons, and to the arrhythmic variables of the environment. So sort of a reconnection with the physical world, the benefits of which on the health have been demonstrated, and where we can use a vegetal to have a positive impact and to facilitate the orientation for a vulnerable population in urban centers. So it's a positive discourse. I could have mentioned several other leverages, but in which we become aware that in order to deal either with active design or inclusive design or sensorial design, well, right now, there should be another way to do the urban planning and look for more transdisciplinarity. Stop this linear process to have a development project, promote exchange and collaboration, and possibly reassess the criteria that will define value in urban project. Proximity green space. I'm sure that following the confinement and the sanitary crisis, well, it does a new value. Well, health is not another layer, there's been the sustainable city, the smart city, now comes the healthy city. No, it's a more holistic vision, which contains all the components. And through the criteria and that of the health determining factor in the territory, well, we can set the answer in what makes the identity of a territory. That is basically, as well, it's the vulnerabilities. And if we can design project that could include the vulnerabilities, it's not just a negation of vulnerability, but then, in my opinion, we can make health an entry point for tomorrow's urban projects. Thank you. Thank you, Mr. Davis, for your great testimony. You gave us a brilliant illustration of the link between cities and health. You've also drawn our attention to the waves of poverty, vulnerability in the various declinations, and that includes medical, social, and so on and so forth. And of course, the climate problem, which is climate issue, which will be discussed again. Thank you as well for enlightening us for tomorrow's city, about tomorrow's city, you know, where health or well-being consideration is not just a layer to be added to the environment or the recipe of the urban cake or millefeuille, but which will be fully cross-cutting and pregnant in all public policies. And then we did note the paradoxical relation that you've established between the rejection of the obsession of the epidemic to make a new city, but we should not forget the epidemic to draw lessons and to capitalize on them. Thank you very much for your intervention. You are enlightening our road. We're now going to the other side of the Mediterranean Sea. Mrs. Swad Ben Abderrahim, thank you very much. Mrs. Mayor of Tunis, thank you for attending our meeting, our exchange today. First and foremost, allow me to say, Madam, that, well, precisely 2 years ago, you had just been elected at that, and you had been very, very kind to host the Agency of Mediterranean Cities and Territories in the City Hall of Tunis for a seminar we organized in Tunis, and Mr. Benaissa referred to it early on. So we've all kept a great, strong memory of your hospitality, of your, you just started in your new position, and in a very friendly way, you've opened the doors of the City Hall of Tunis. And well, this is possibly the way we're going to construct the Mediterranean, the spirit of the Mediterranean of the future. We keep this in mind. We haven't forgotten. We still have Tunis in mind, in our heart, and we owe it to you. Mrs. Mayor. So you're the mayor of the capital city of Tunisia. Your city, like many other urban territories in Mediterranean and everywhere, have been impacted by the COVID crisis. What can you tell us about the way this has been handled at your position, and what recommendations can you give us around the Mediterranean, because we all ask ourselves the same questions. Thank you. Thank you, dear friends and colleagues. First, allow me to thank Mr. Bernard Valero, Director General of Avitem, for this very kind invitation. Avitem is a very efficient agency to the service of our Mediterranean cities, and the city of Tunis is quite grateful for the support received from the agency, especially to ensure the best urban planning and to make Tunis a metropole of the future. I've been very impressed by everything has been said, so I feel highly responsible. I represent the Tunisian women. As you all know, for several months now, we are dealing, each and every one of us, to a global, unprecedented global crisis. The lockdown policy, very strict, implemented during the first wave, had positive results on the health level, but it caused an economic crisis and also unprecedented. And it is actually the economic situation severity that stopped us from restoring a general lockdown to stop the virus. But still, we implemented a local policy which is based on three major actions. First, awareness raising of the population in in different districts, reinforcement of municipal departments, and daily presence in the public space. This crisis had obvious impacts on the city of Tunis, and we led us to major challenges because we had to ensure the best living conditions for our citizens. So therefore, we wanted to make sure that the municipal council, city council would have this principle of support to people through the education and awareness raising, hygiene, as well the fight against poverty, and this while listening to the citizens 24/7.
Which means being close, as Mr. Benares has said, being close to a global vision, as our dear friend just said. This pandemic has led us to reinforce our partnership with the civil society, with the private sector, and with international institutions. And we have also reinforced our cooperation with our international partners who've been present whenever we needed them, and they have supported us either through funding or through expertise. This pandemic has proven the necessity for us to adopt an efficient strategy so as to strengthen the resilience of our cities. The coronavirus has proven our vulnerability worldwide and has encouraged us to rethink our local governance. More than ever, we need a transversal governance that connects all services together so as to provide the support that needs to be provided to the most vulnerable. More than ever, it is necessary to rethink public infrastructures. This being said, the solution will not be either local or national. We will need international solidarity so as to strengthen the resilience of our cities. All this means that we need to be more concrete and we must concretely answer the needs of our citizens, which means live the cities in a better way. In the framework of our collaboration with AFAO, we are creating green spaces and we want to ensure the economic inclusion of the youth, especially in the most vulnerable areas. And we also have a project to that aim with the board. We want to provide to our citizens some appropriate spaces where they can live in peace, even in times of crisis. Besides, we are working with competent partners so as to encourage mobility for all, so as to reduce overcrowding in public transportations. We want to develop cycling areas and facilities, infrastructures for bikes. We want also to improve digitalization. We must create a better environment for people who work from home, and companies must have the appropriate support from their cities. The smart city is not limited to basic services. We must also provide services to the youth, the youngest, nurseries, distance learning. Why not distant health, if possible? We want to implement an efficient strategy, and this is why we work with our international and local partners as to create the Tunis of tomorrow, a resilient city. We have star projects. We will take from our riches and get some inspiration from our reality so as to profoundly change our socio-economic reality. We want a participative approach, collaborating with companies and startups, and we want to create the necessary infrastructures with the appropriate partners. Thank you for your attention, and let's keep hope. Thank you very much, Mrs. Mayor. Your message of hope touches us, and thank you for underlining this. We heard your message. We know that citizens are at the very heart of your preoccupations. The first line of action was the community of health workers, but all of us in our own ways were soldiers against the virus. With the mask, with the way we behave, we individually and collectively took part to that battle, and unfortunately in many places this battle is still going on. You reminded us that public policy must answer the expectations of their citizens, especially in those circumstances, and thank you very much for stressing this dimension, which is particularly significant, and we will integrate this into our analysis. Once again, thank you, Mrs. Mayor. You have also underlined that in these tough times, international cooperation is indispensable, and I now give the floor back to Mrs. Rampal because she is the expert on international collaboration. Mrs. Rampal, in this context of sanitary crisis, of reflection on the connections between cities and health, on how we can do in Marseille, in Tunis, in Barcelona, in Beirut. What are the answers that you can suggest in terms of Mediterranean cooperation in the present situation? Thank you, Bernard. First of all, let me thank you, Mrs. Swed Abderrahim, the mayor of Tunis, because I have nice memories of the time we spent together in your city of Tunis 2 years ago. Through the Euromed Cities Network, we organized in Tunis the third event dealing on the fight against radicalization and violent extremism. And after the great event that we had organized in Nice after the terror attack of the 14th of July, and after the attacks on Beirut, the event in Beirut, the third event was held in Tunis, in your hometown, and it was very interesting. Bernard, you're right. The notion of networking, relations between cities. All speakers also said that our cities were the epicenters of the pandemic, because the pandemic spreads where there is a high density in population. This is a brand new pandemic. We're used to pandemics hitting one city, as happened in the book of Albert Camus. Those who die, die, those who may live, live. But now it was different. All of us became locked down in our apartments and nothing was working worldwide. And that's quite new. That's the new thing. In the Mediterranean, it's been a tremendous change in the way we live as Mediterraneans. We like to meet people, to go out. We have huge family parties. So all our way of life had to come to an end. And because of that pandemic, we now have to rethink our cities for the future. The network, of course, we are going to reactivate it because we will use it to reflect amongst ourselves to the solutions put forward by all of us so as to answer the needs of our citizens. And it is very interesting to see that, for instance, the city of Marrakesh communicated a lot on the dangers of opening up after the lockdown. The city of Tunis and the city of Nice have been extremely vigilant towards their most vulnerables because those suffered more than anyone else. And in Tunis as well as in Nice, we have been very careful to provide the best support that we could to those people. Now we are facing a worldwide problem, and exchanges between our communities who live the same way of life, well, this is quite essential. On our own, we will not find a solution. The solution will come from our exchanges, trying to identify the best possible approaches. Thank you, Mrs. President. As you're saying, we are not going to succeed on our own. We must find a collective answer. Today, it's COVID. It has no frontiers. It travels very fast from Wuhan to Marseille within a few hours. Tomorrow, it will be the challenge of the climate, and there again, we'll have to work together amongst ourselves as Mediterraneans, because this Mediterranean space is particularly vulnerable in terms of climate change. One more question, Mrs. Rampal. We are coming to a close, and once again, I thank you for taking part to this workshop. But not only are we reaching the end, but we are reaching the end of Act 4 of this project, Mediterranean for the Future. This project was born 4 years ago. Our Mediterranean stood through these times of virus, and it enabled our very fruitful exchanges. I will come back to the question that I had in mind. I wanted to ask you, what are the great lessons that you draw from what was said here these last 4 days? This is a difficult and very interesting question. First of all, I'd like to come back to what you said, Bernard. You said that we are going to be facing other challenges, climate change, the environment. The Mediterranean of the future, as wanted by our President Renaud Muselier, already anticipated on all these challenges. This pandemic is coming to an end, so to speak, because we have hopes for a vaccine that will enable us to resume with our lives this year. But there's no vaccine against climate change. There's no remedy against pollution. Once the Mediterranean Sea will be dead with pollution, there will be no way back. Just think of the Sea of Aral or other ecological disasters. Every year, as Mediterranean cities, we own a little bit of the shore of the Mediterranean. It is in our hands to try to slow down these problems or find solutions altogether. This year, this Mediterranean was strong throughout the events, thanks to our president. In spite of the cancellation of all great events, this event was maintained. It took place in a different way. We lost in conviviality, hospitality. We lost many exchanges, but we are still here and we are able to reflect together on these issues which have preoccupied us since the beginning of the year. And all together, we strengthen each other. And we want to be there and fight even more. The Mediterranean has resisted COVID, and this is a great signal for the future. It shows that our region, with all our partners, our cooperation partners, and there again, I pay tribute to the wonderful mayor of Tunis who's with us this afternoon. So all together, we can write a future that is less somber for all our children, and God knows that our children need to inherit of a country and a Mediterranean which is in a good state. Thank you. Thank you, Mrs. Rampal. Upon these nice words, which show that our yearly event is turned towards the future, the time has come to once again thank warmly the Mayor of Tunis. Mrs. Mayor, you yourself and your city occupies a very particular place in our memories and in our hearts. I also thank Mr. Davis. I also thank Mr. Amin Benaissa. Mrs. Rampal, thank you. Thank you so much. Thank you, everyone, for being kind enough to manage this event and to overcome all the constraints of the pandemic. I thank the wonderful team of the region. They are right here behind the camera. Thank you, Raphael. Thank you, Guillaume. Thank you very much, and see you next year. And in the meantime, we're going to keep working all together, as you just said. Thank you all. Goodbye.